and a very good evening to everyone joining me here. You're watching News9 Digital. This is a Facebook Live. Thank you so much for joining me. We've spoken about the vaccine, the challenges that the making of vaccine is facing. Today we are going to talk about what if the vaccine gets the nod and then it has to be distributed across the country. Now the vaccines to even get a nod, it's going to get a few months. The best case scenario, of course, is being touted as March 2021. It could perhaps take much longer as well. But even as the vaccines do get the nod from DGCI, how long is it going to take for the vaccines to be distributed to all? How is it going to be distributed? Will you have to go to the hospitals? And, is it first going to be given to the frontline workers and to the vulnerable section, and then perhaps to people across the country? Considering our population, how difficult is it going to be to ensure that access to vaccine is available for all? These are some of the basic questions which I'm trying to address today, because these are some of the questions that come to mind, and a kind of pandemic like this has brought about several questions for people across the country. So to talk to us more about it, Dr. Prashant joins us over the phone line. Many thanks for joining us, Dr. Prashant. We've spoken of the challenges that the vaccine is facing. It could take a few months, but let's say the vaccine gets a nod. How difficult is it going to be, considering our population across the country as well? We have to ensure that everybody gets access to the vaccines. And we also heard the statement from the Serum Institute of India, where it said that to have vaccines for everybody across the world, it could even be 2024. So that would be for 2 doses for everybody, the vaccine reaching. But once it gets a nod, how long will it take, and what are the challenges really that, the authorities are going to face once the vaccines get the nod?
Yeah, thanks. Good evening to you as well. So this is a very important challenge, and I think is only beginning to be addressed now, because right now we have the media attention has been heavily on which vaccine will make it. Yeah. We have also seen instances of what is being described as vaccine nationalism, where countries try to race for doses. Yeah. You have examples of US trying to buy up in advance several doses for their population, etc. So I think in India, the challenge is exactly like you pointed out in your intro, the distributional disparities. Yeah. So even if you take existing vaccines, while the vaccines that are given at birth, like BCG and DPT, have high coverage, as you go upwards, when you come to the measles vaccine, which is to be given later in infancy, you have much less coverage. And you especially have lesser coverage in more remote parts, as well among the poor. The most vulnerable have worse off coverage with respect to vaccines, even for those that exist. So this is a very important challenge, and I think we should use up this time in the coming months before we actually have it in having a very decentralized planning strategy. Yeah. Now, coming to whether this exists, there is a very sophisticated infrastructure, thankfully, that Government of India and state governments have. It is basically the primary healthcare network. So in all of the rural areas of this country, we have health workers at each village called the ASHAs, the accredited social health activists. Yeah. Almost every single village has an ASHA worker. So ideally what ought to happen is some kind of a village level micro plan, a primary healthcare level micro plan, where people identify the needs and requirements for these vaccines. And this kind of a bottom-up planning, if effectively implemented at district level, at city level, we could see a scenario where we can achieve better distribution of vaccine. Okay. But that said, this kind of a planning exercise itself will take many, many months to be able to roll out and achieve significant coverage of vaccine. Will take many, many months. True. So, coming to another question on what about prioritizing, I think very likely that the government will prioritize on which are the groups that need to get priority access. And there the frontline health workers, and not only frontline health workers, frontline public services, various other public services need to come, be it public transport workers, police, various other public service, postal department employees. All of these who are at high risk of exposure are likely to get it first. But of course, I'm speaking as a public health researcher who's outside the system. So there are various committees and expert groups, both at national and state level, which have public health people and epidemiologists who I'm sure will start beginning the exercise of planning the delivery of vaccine to the corners of a very diverse country.
So, Doctor, if we compared it to a few government schemes, of course, it won't be a fair comparison, but since we have not had a situation like this where vaccines have to be given to people across the country, because vaccines being given at birth is completely different for the completely different from the coronavirus vaccine, which will have to be given to all. So this will bring about its own set of challenges. So if we just compare it to perhaps say a few government schemes that have been introduced as well, it has been very difficult to implement on ground because of various challenges, lack of manpower, lack of skills for all as well. So these are going to be some of the basic challenges. I'm sure there are a lot more as well. So how will these challenges be addressed?
Challenges, no doubt. For example, what is called as a cold chain, one of the basic challenges in ensuring good quality vaccine delivery is what is called as a cold chain. How do you ensure that the vaccine reaches the most remote areas at the appropriate temperature? Many vaccines will require to be maintained at refrigerated, otherwise they lose their efficacy. So cold chain maintenance will be a very important problem. But coming back, I think cities will struggle much more than rural areas, because rural areas have a robust primary healthcare infrastructure. Every 10 to 15 villages in Karnataka, for example, has a government primary health center. Each of these have a medical officer, a lab. So I think scaling up in rural areas is going to be, I wouldn't say without challenges, but easier than, let's say, in Bangalore. Unfortunately, in cities like Bangalore or Pune, etc., we have a heavily mixed public and private system. We have a lot of private clinics, corporate hospitals. So in cities, the challenge of bringing together and partnering with multiple types of private hospitals, etc., will be the challenge. Whereas in rural areas, I think the infrastructure exists. Even for example, we work in a place called BR Hills. It's in Chamarajanagar district, forested area. And many of these forested areas as well have their auxiliary nurse midwives. We have ASHAs, and there are sub-center buildings. Many of these buildings can be converted into vaccination centers. Enrollments can begin beforehand as to mapping who are all in my village are eligible for the vaccine. Health workers can be trained. So all of this can be done in rural areas. I feel the challenge will be in cities.
So
last point on this, just one last point is, there are very interesting technology solutions that have come up. For example, drone delivery. In Arunachal, I believe some NGOs have tried delivery of vaccine kits via drones and other special sort of aerial vehicles in remote areas. You also have other technologies. There are some companies which have come out with centralized vaccine monitoring dashboards, where and even Government of India now has an electronic system of tracking centrally what are the vaccine stocks available at different primary health centers. So if these technologies are leveraged appropriately and adequately early on, we still have preparation time. That's the key. We should use this time to prepare for this kind of deployment.
So, such kind of preparation, should we begin doing that already, or will that be done once, any vaccine gets a nod? Would that be done? And also, given the sheer population of our country, we've already seen coronavirus overwhelming healthcare system across not just the country but also across the world. So given the fact that vaccine will have to be given to people across the country, can our healthcare system manage such a situation? Would we need to get in manpower from outside as well? If yes, when will that be done?
No, I think it's definitely manageable with challenges, but manageable. But this has to be done in a decentralized way. For example, you remember the first lockdown, which got implemented at a national level. It was devastating because the entire country was locked down suddenly. Whereas this kind of activity needs some kind of bottom-up planning. So, from we need to have action
coordination between
plans.
states and the center as well.
this responsibility has to be shifted to the states. It can't be done for a country. It's even if you assemble a great panel of experts, we will not be able to plan a vaccination strategy for a country as diverse as India sitting in Delhi. So we have to do this in state level and so state to district coordinate. So there has to be this kind of a bottom-up planning, and district should prepare some kind of an action plan, submit to state. They have to be collated, and this has to happen simultaneously while the vaccine calendar gets announced. So once we know that, let's say, April or May the vaccine is coming out, we should already have some kind of an estimate as to how many doses will be available, and we should already start triaging or prioritizing across populations, states, geographies, and planning that way.
Okay, all right. Dr. Prashant, many thanks for joining us with your expertise on that. So there are different challenges. We've seen that with, like the doctor mentioned, the lockdown as well, various government schemes that are implemented across the country as well. It has various challenges, especially about it not reaching the grassroots level as well. But this is a pandemic. It deals with the lives of the people. So it will need a lot of coordination from the center as well as the states as well. We have a robust healthcare system. Yes, it might be overburdened because of coronavirus, but in a pandemic like this, people are going to put in their best efforts. Let's also hope that everybody will have access to the vaccines once it is manufactured en masse, and we can rest assured that yes, there will be a plan in place, and there will be enough preparation in place as well to ensure that everyone gets equal and fair access to the vaccines. That's all I have in this video for you. Thank you so much for watching. Please let me know in the comments as well what you think of India's planning, when it should start planning, and the accessibility for all as far as the vaccines are concerned. Thank you so much for watching. Take care.